Hey, everybody. We've got an important conversation today. Please join us for CBD and fertility. This is an Ask Me Anything, although I'm not the expert on CBD and fertility. So we're going to have a great guest today joining us. We try to let everybody know about this one in advance because it is such an important topic of conversation. So Avrio Genetics is joining us. I'm inviting Brandon, the founder, who's a good friend of mine, just an awesome entrepreneur, super inspiring in the field. Hey, Brandon.
Hey,
Hello. We made it work. I'm going to turn you.
I'm glad.
You're projecting in my ears. I'm going to turn you down.
Sorry.
But yay, no, you and I are very excitable people already. So sorry about the delay, everybody, but we're so excited for this conversation. You know, I will tell you one thing. This conversation surprised me immensely, and it's surprising a lot of people. So we understand that when it comes to the benefits of CBD, that in a lot of cases it outweighs the risk to our reproductive health. Okay, so I just want to clear that up right off of the bat. We know that there are health conditions that CBD is being very helpful for. But before we dive into starting to answer some of the questions that came in from our Instagram story, I want to make sure that Brandon has proper introduction and has a chance to tell you about sort of the genesis of Avrio Genetics first. So Brandon, take us a little bit through your background and how the CBD epigenetic test even came to be.
Yeah, absolutely. Well, thank you for having me on. It's always a pleasure to come on here. I feel like it was yesterday that I was on here last talking about non-invasive PGTA, but I looked up. I think it was like over a year ago.
It was, but you have over 5,000 views on that conversation.
Yeah, it's crazy.
Yeah.
so I'm really happy to be here today. You know, it's been for anybody who's on here who isn't familiar with Avrio. So we are a reproductive genetic company with the primary focus of. I know this sounds like a daunting task or an ambitious goal, but our primary goal, our vision as a company is to reverse the declining fertility rate in the world and make it possible for everybody who dreams of being parents to become parents. So that really is driving everything that we're doing from on a daily basis. For every decision we make, everything that we do in the market, that is our vision and what we're striving to do. And that's why I love working with you, Alice, because we're very much aligned on many fronts. And so Avrio, we've been around for several years. We actually started out by identifying companies throughout the world who were developing unique and interesting reproductive genetic technologies and services that would be designed for the IVF or for the fertility world. And for people who are struggling with infertility. And we started out by identifying who these different companies were and trying to bring together a single unified solution to deliver more of like a one-stop shop for the best services in the world where people could have access to that.
Love it.
And over time, we began realizing that not only are there's so many services, so many technologies out there that can benefit patients and doctors, but we started to really recognize that there were things that really needed to be addressed that weren't being addressed. And
right.
We believed that we could bring a lot of those solutions to the market. And one of the primary things that we saw taking place over the past several years is a shift towards patients and people wanting to control more of their fertility journey and more of that process, not wanting to just kind of sit back and just be told what to do, but to really want to take control of that. And from a treatment perspective, from who they were going to see, from what they were being taught, what they were learning about the process, everything. So we really began trying to shift the company into or add into Avrio a much more patient-centric focus, rather than just a focus that was only delivering technologies to clinics. So when COVID came about in the beginning of 2020, it really pushed us into making that idea a reality, because all of a sudden people really were like not able to travel. People wanted to make sure that they were more in control of their lives and what they were doing. And so we thought this right now is a time for us to really make an impact in the world when people are feeling down, that they can't go and, you know, if they're in the middle of an IVF cycle or going through treatment, you know, that if they can't actually go anywhere and feeling like they're going to be set back. Well, we wanted to be able to deliver something or many things that would make it possible for people to advance their care and care for themselves through this whole process.
I love that. One of the things for all those who are listening that we just talked to Dr. Green about last week on improving egg quality is this 120 to 160 day window. So as we dive into the conversation of what is epigenetics and what's the impact on everyone, the thing that I want you all to be listening for is what are the things that I can do? What are the things that you can do in only 120 days, only 160 days? Why? Because for both men and women, the healthiest sperm and the healthiest egg is going to be released in 120 to 160 day window. And that was the first time that I really heard anyone talk about egg quality that way. That we too, because we talk a lot about male infertility and male sperm quality, and that they have such an efficient body compared to ours, right? Because you're constantly producing new sperm and it takes that magic 3.5 months for that sperm washout. But the exciting thing that Dr. Green was saying is it's the same for women, except releasing 15 million sperm compared to our one egg. But to know that we have autonomy and we have control about what goes into our body and that we only need 160 days to get to that healthiest egg, I think is really empowering and really invigorating. So that excites me about this. So everybody out there, I want you to start asking your questions. I know you gave us some already that I'm going to get to, but I want to start by talking about the fact that the legalization of marijuana is taking off. You know, people use CBD for all sorts of things, me included. When I was going through chemo, ingesting CBD in edibles, literally, I feel like saved my life during chemo. It saved me. I mean, everything else constipated me, made me feel miserable, gave me anxiety, made it hard to sleep. And one teeny tiny little corner of like a CBD infused brownie, and I had all those side effects go away. But the question is, what is the epigenetic impact on CBD? And I think to address that, Brandon, you have to kind of break down the definition of epigenetics for us.
Yeah, absolutely. So in looking at the effects of CBD on reproductive health, we're actually looking at the effects of not just CBD, but on all cannabinoids. So CBD, THC, across the board.
Okay.
And so just to explain what epigenetics are, it sounds like a crazy term, a term that not many people have heard of, but everybody's heard of genetics. And so well, I think most people,
I think so.
When you think about genetic testing is fairly static, right? It's giving you, it's
so letting it's like, this is what DNA. You were born with, right. This is what you were born with, right?
Right. Like, it's like, this is what you're at risk of developing, or this is what, these are your genes, or these are the diseases you might carry, things like that. But they're not, most of the time, genetics aren't not constantly changing. I mean, there's so genetic testing can be very static. Epigenetics is actually the study of how your genes express themselves. So it looks at what kind of environmental influences or lifestyle choices or things you're eating, things you're drinking, whatever it might be, stress, a million things. What are the ways that these lifestyle effects or things going on in your life, how are those things affecting the ways your genes express themselves? Right.
They might turn it on or turn it off.
Exactly. And so, like, for example, if you have and I promise I won't get nerdy. I'll just explain. I'll explain.
Exactly, like our users like nerdy.
So you have your genes and your DNA. The reason that the reason that some of your cells are liver cells and some of your cells are lung cells or your eyes, whatever it is because even though your genome or all your DNA is the same in every single cell, it all depends upon what kind of enzymes are attaching themselves to that DNA, which causes those genes to say, hey, because this is like an enzyme from the liver, I'm going to respond and create a liver cell. Right. Or if it's your DNA in another area, it's going to create a different type of cell. I mean, that's a very basic example, but enzymes can come in many different forms and can actually cause your genes to express themselves in a way that they shouldn't be,
Ah,
or can stop expressing themselves. So there's a specific gene that we look at on this cannabinoid test, the analysis, that in the presence of CBD or cannabinoids, that gene, where it normally expresses itself in a way that can create positive effects on reproductive health, in the presence of cannabinoids, it actually that gene gets silenced and stops producing the signals and the RNA that it's supposed to be presenting. And so that's what epigenetics is.
And I think that's a great explanation. We have a really important question that came in privately, and I think this user jumped on to ask the question publicly here. Thanks, Rocky, your doll. So good to see you. And so the Carter wife, is taking THC for Crohn's, okayed by her OBGYN. This is very new research, right? This is not something that's widely understood. It's not something that's widely known. So I think probably it'd be the first time her OBGYN ever even heard that this might have an impact,
Right.
But it doesn't have an impact with all people in the same way. And that's where the genetics come into play, right? So if genetics are responsible for 30%, 70% is lifestyle, and everybody's epigenetics has a little bit different impact too, right? It's not all the same.
Right.
Which is why the testing is important to see which of your genes are being impacted, because her big question is, well, then what does she do? So first we kind of need to look at, well, what is the impact? Because we know it's super positive for her Crohn's. We know that it's way better than being treated with chemo, and some of the other really aggressive, treatments. And so she's thriving in the quality of her life with Crohn's, but yet she certainly wants to be able to still pursue parenthood. So what is the test going to tell her in a way that's actionable so that she can kind of counteract which of her genes are really impacted? For instance, let me break this down really specifically, the Carter wife. What if her uterine receptivity is fine, right? Meaning that an embryo can attach, but her egg quality or egg production goes down. Could she take omega supplements? Could she do acupuncture? Could she maybe do a Clomid cycle to stimulate the release of the egg?
Right. And that's exactly why the benefit of the epigenetic testing is, because epigenetics are the measurement of how your environment and choices are affecting the ways your genes are expressing themselves. That also means that you can do something about it.
Right. So it doesn't mean you have to stop ingesting THC or CBD.
Yeah, it means that you then, and that is where that is our primary goal in creating epigenetic testing, is giving actionable results. Amazing. So that you're not just like looking at something and being like, oh, well, this is negatively affecting me. But instead you can be like, okay, this is negatively affecting me, but here's what I can do about it. And you're right. There's a myriad of benefits with various cannabinoids, like the example you gave, and there's the example that the Carter wife gave. Like there's so many examples like this where you're right. Like if you're being prescribed it, there's a need that you have for it. That's the whole idea, is that we are trying to help you see if it is having an effect on reproductive health, and how then you can find a solution to cope around that problem.
Right. Exactly. Yeah. Right. I think you gave, look, every medication has a side effect, right? Everyone out there, every single thing that we ingest, like blueberries can be really good for me. My son could be allergic to them. Right. So this is all like heading into like very personalized and precision health and wellness in general.
Yeah.
And I think when I think about it too, and I think about the fact that the research shows that if you've smoked 7 times, I think you told me, Brandon, you're 60 times more likely to have an issue with uterine receptivity.
Yeah. Yeah. It's not, yeah, exactly. And it's not just with uterine receptivity. It's what's really interesting is you look at in some of the research that exists already, showing that endocannabinoids are present in fluids, whether it's in various fluids, in the uterine, in inside cells, in follicular cells. It's like it's
everywhere in your reproductive health. Yeah.
And,
okay.
And
stem
so
cell, I mean, since it impacts the sperm production process, is it present in the fluid in stem cells too of sperm production, sperm stem cells?
I don't know. Actually, I'm not sure, but in everything in all of the research so far, it's been present in
Wow.
every fluid in some way, shape, or form. And what's really interesting is in chronic exposure to cannabinoids, whether it's THC or CBD, one of the primary effects that it has is that it shuts off the signaling pathway to produce hormones, sex hormones.
Ah.
So that is where
That's interesting. Wait, can we pause here for a second? So when people start smoking in high school and they lose motivation and are sort of, there's always that like stigma of being perceived as lazy, but really it might be that it actually lowered the production of testosterone.
could be.
Holy crap, that's a big deal. Sorry, guys. That is that's the first time that I've heard that. Whoa.
There's a lot. And you think, that's why when you see
that's a big deal.
When you look at like all of the pathways that are related to like maturation, with like
right.
GnRH secretion and all of that, that's all directly related to, it's all sex hormones. And
right. When we say that, we try to tell people not to smoke weed in high school, and we used to just say you're killing brain cells. It's a bigger deal than that as it relates to reproductive health, because you literally are disrupting your sexual maturation process.
Yeah, you could be. Yeah.
It could be. Yeah. Right. Yeah. So let's talk about this. And you're welcome, the Carter wife. I'm so glad you came and asked the question. So I hopefully that put you at ease that there is something to do. And hopefully we can connect you as being one of the beta testers, even of the test itself, because Brandon's going to release 10 to our community to do the first kind of pre-release of the test and receiving the report and helping his company then make sure that it lands the right way and it gives you the right kind of advice. So let's talk about different forms though. In the research, does it talk about, I want to know two things. Does it address the different strains of CBD and THC? And if the strains make a difference, and I'm not going to remember all the terms that I learned 13 years ago when I was, ingesting it. I was like, don't give me the kind that keeps me awake. Don't give me the kind that makes me happy. I need the anti-anxiety, the calming, the sleep help, which I believe is sativa, but I could be wrong. And those of you who are better at this than me, pipe in. So the question is, has the research studied if there's a difference, right, in the two forms? And has the research also evaluated how it's entering the body?
Yes. So yes, the answer to both of those questions is yes. So, there's a lot of qualifications and caveats to it, and that's so to back up on that for a second. Back 3 months ago or so, the FDA issued out a invitation to participate in multiple roundtables to investigate the effects of cannabinoids on reproductive health, because they wanted to do more research on it, and there was nobody really focusing on it. It was so interesting because it was like we were pulling in signals from the universe. Right.
Exactly.
It was like 2-3 months before that, starting to have the conversation about developing something like, well, this is it's really a significant issue. And so the initial sets of research that have been done have been in primary category, just in the general categories of just endocannabinoids in general, or in cannabinoids in general.
Okay.
Then there are more studies that are specifying, looking at THC and CBD and different types of THC and how each of them are affecting the system in different ways. But what's really interesting is as a general category, the cannabinoids are still affecting the same pathways, because no matter what, your cannabinoid receptors in your body, CB1,
they're everywhere.
CB2, and they're the same receptors. But then once the cannabinoids enter your system, then there's definitely different effects. But the research has to really play that out and see what exactly that is.
Okay, interesting. And D Presidente is asking a really great question. So some people, and qualify who they is, D Presidente, if you don't mind. So we do know that some recommend CBD oil for women with PCOS who are trying to conceive. It's not usually, that's not something in the IVF community we see frequently, but we do see it outside of the IVF community in naturopathic medicine, maybe functional medicine, maybe some other integrative approaches. So the question is then, we need more research. She's like, well, why are they doing that? I mean, people don't know. So how is this research even getting propagated in the public, right? And also in the healthcare system, because doctors, if they don't know this, then we don't want women receiving the wrong information. We want to empower them with the right information. We're not advocating or saying, just because this has an epigenetic impact and this is the risk of it on your reproductive health, you should stop using it for the things that you're using. Right. We're not saying that at all.
No, not at all. And that's why having things available that you can have available to you at home, as opposed to having to only have to go to a clinic and find things out. That's why this is beneficial, because let's say it's in any of these categories, in any of the questions that people are asking, where you're using the CBD product for a reason that's helping you.
Exactly.
It's really good. It would be really good to know, is there anything negative that this is causing?
And I would ask the question too, if the further away you are from the receptor site, right? So like if smoking gets you the fastest pathway to the receptor site, if ingesting is a slower pathway to the receptor site, if oil is the slowest pathway to the receptor site, I would want the research to show me what that impact is like, right? Like if you're super fast there, it might have the biggest impact, right? But if it's a really slow metabolic experience, does that make a difference in the epigenetic impact? And it's not going to be the same for all people. I think that's like the key in this conversation, everybody, is epigenetics is super duper personal to you, to your genetics. And that's what we're trying to help you understand with this. Yeah.
It's exactly right. And a very easy way to look at this as an example that I think a lot of people would understand is, I've had horrible allergies my entire life, but Claritin does not work for me ever in any way, shape, or form. But Zyrtec does. But on the Claritin bottle, it says it's 99.9% effective. On the Zyrtec,
0.1% that it's not
on the Zyrtec bottle, it says it's 99.1% effective.
Interesting.
So a lot of people would pick up that bottle and say, I'm going to pick the one that is more effective. But that's just because that's what the general research has come up with.
Right.
But it's not personalized to everybody. But for me, it doesn't work.
Right. And you had to learn it the hard way.
Right. And so that's why with this epigenetics, it's doing the same thing. It's preventing the guesswork, and it's helping you to see if something is negatively affecting you and what you can do about it. And from a where this can be really, really useful is even taking another step, so that it's not just like, oh, I use CBD or I smoke weed or anything like that. It's like, and then taking the test only in that situation. What's really interesting is using it in a setting that if you have had and struggled with infertility, or if you're struggling with infertility right now, and you've gone through tests after tests after tests, and nobody is figuring out what the problem is. A lot of this research is showing that even exposure a few times in your life, in some cases, can leave permanent effects on your reproductive health. So this could actually be a way to look and find hidden causes of infertility.
So even though 13 years ago I ingested that cannabis, which I would do again in a heartbeat because of how beneficial it was to me during coping with chemo, everybody. I mean, I really want to underscore that, but it could have led to my early pregnancy losses, or maybe the risk of the early pregnancy losses, because there's a lot of different factors that go into that. Now, I successfully did my frozen embryo transfer, had no issues with uterine receptivity 5 years after I had ingested my CBD infused, brownies. I always went for the brownie. so I didn't have any trouble there, but I most definitely, and which could have been chemo related, it could have been CBD related, could have been both related, right? Because I think that's the other thing about even chemo and some of the other health things that we have to take, the Zyrtex or the whatever it might be, is that it is usually an epigenetic impact, right? And like that's the thing about
everything is
gonadotoxic anything, whether it's plastics or microplastics or anything else, is that it is having an epigenetic impact.
That's exactly right. It's 100% accurate. Everything is an epigenetic effect.
Right. And and I love that, because I think about, women get like really, in our infertility community, everybody's like, eat pineapple core, right? It reduces inflammation, but it doesn't reduce inflammation for everyone. It reduces inflammation for some people.
Right.
Right.
Right. Exactly. And there's like even like the development of cancers, or
I've said that, right? Or not even just sun, but like stress. I've said forever, I believe, and they don't have a way of telling this, but I'll share the story with our community. And there's a really good question about Marinol we need to answer, is that I was predisposed to developing breast cancer at some point in my life, but most likely postmenopausally, because that's when other women in my family have been diagnosed with it. But I got it at 31. And if I look at my history of trauma, my history of high stress, Dante, don't be rude. Everybody's used to Dante being rude sometimes. In 10 minutes, love. And when I think about that, I'm like, there had to have been an epigenetic accelerant. So I do want to go back to Marinol, right? Because Marinol is prescription THC. It's something that the FDA cleared, but now we're talking about a synthetic, but it must have to interact with the same receptor sites, right? In order for it to work.
I would imagine so. I mean, yes. I mean, it would have the same effect as a cannabinoid, even if it's synthetic. But I don't know. I don't want to speak. I don't want to speak to something that I'm not extremely familiar with.
Mm-hmm.
But I think that in any that's the message I want to make sure is really clear in everything that we're doing, is that in all of this, I'm not trying to create something that's going to prove that marijuana or THC or CBD is bad, or try to convince people to not do it. I'm not. I'm trying to help people try to find a way to resolve any negative effects that it may have or may have had.
On the path to parenthood.
Mm-hmm. Right, exactly. And so like if you with Marinol, with any prescription THC, with recreational use, with CBD, whatever it might be, like there's this is not it's not a drug test.
Right. Exactly. That's a big deal, you guys. Taking it is not a drug test. I mean,
that's right.
You could have been around CBD and, at a college
exposure.
Party. It's just exposure. It's like microplastics. That's what we keep saying about. It's like, you can't, and you're drinking water, you're ingesting chlorine, you can't get around epigenetic impacts on anything. So I think that is an important consideration, is that what we're talking about is having the knowledge that you need to make lifestyle choices that can counteract any of the negative effects that you're experiencing. And CBD is just one of the first epigenetic products that you're bringing to market. And it's called Unveil, right? I kind of like that name. Yeah. But you have other epigenetic products that are coming too, that are a little bit broader, right?
Yeah. And so one of the other products, it's called Reality, is a test that looks at your epigenetic age. So this is something that is being further developed, but in looking at epigenetic age, so obviously advanced maternal age is a huge contributor to people struggling with infertility. And a word,
and usually a term we don't like, but yes.
No, I'm just saying.
No, I know. It's not. You didn't name it. But we typically, because it's used for when you're so young, we don't typically love the term. But yes, advanced maternal age is a very real thing. Very real. Age-related infertility it's a very real thing. No, it's not your fault. You weren't the white man who came up with the term. There was, I'm sure, a white man who came up with the term, but it wasn't you. So no, it's not a big deal at all. But I think that this idea idea of epigenetic age is an important one. We constantly talk about your
Age-related
ovaries
infertility.
aging, but your uterus, we're not so concerned with the age of your uterus. We are very much concerned with the age of your ovaries. But in the epigenetic world, are we going to be concerned about both? In the epigenetic age test, are we concerned about both?
Yeah, it's looking to see epigenetically, is there a faster aging process than just your actual chronological age?
Right.
And so that is looking at what your epigenetic age is, because that can actually make a determination on what exactly it is you're being tested for, and what treatments the doctor, an IVF physician or specialist may actually work with you on. So it's looking at to see, like, if you're very young and you're struggling with infertility, the epigenetic age test, this reality test, could actually help you see, like, there's a faster aging process going on, whether it's uterine age, ovarian age, like.
But it won't tell you the cause of that accelerated aging. You'd have to like look into your lifestyle and say, you know what, my stress is really high. So like, I know for me, with the whole idea that probably contributed to when I got cancer, not if I was going to get cancer. Yeah. And, so probably, but we can reverse some of that too, is sort of the point. So, and actually the Carter wife is asking a phenomenal question. I think a really important one is, she can still feel inflammation in her body. Now she has Crohn's, she has something that causes inflammation in the body. The THC is helping her, but she still feels like there's inflammation. So do some of the gene or the genetic markers that you look at on this epigenetic test, do they relate to inflammation that has kind of an impact on reproductive wellness? Or is that something you can add later so that she can kind of work with that? Because a lot of times inflammation is at the root of infertility. Yeah.
Yeah. I mean, that is something in other tests that we can look at, in the CBD one and the reality test. I do another one that's focused on ovarian reserve as well. I have a pen on my pocket here, and I'm writing blindly, so my notes are going to look like chicken scratch. But I'm gonna find out, and I'll find out. I'll look into what we can do with that, because you're right. I mean, if you can find out if inflammation is being caused by an epigenetic factor, it'd be really interesting. And and just to give it kind of an idea of how the therapy part works and how you make these decisions. When you think about like people who are like stuff like going through cancer treatment, a lot of the drugs that are introduced are tumor suppressor drugs that actually turn off an overproductive gene.
Right.
So that is the kind of the same concept, is when you can identify what genes are being affected epigenetically, then you can introduce therapy that is specific to how those genes will respond. And that's the concept here of what we're trying to develop, is so we need the
epigenetic inflammatory test, the inflammatory epigenetic test might be a better thing. So this is great. The Carter wife, I think you just gave Brandon an invention that is really important out there. And so just to give you some ideas about like bringing that home for you, there might be, now granted you have Crohn's, so you probably are completely gluten-free, but there might be other things that don't have gluten in it that cause you to inflame. It could be something that you think is really healthy for you, like sunflower seeds. It could be a fruit. It could be, a naturally occurring sugar. It could be something else. It could be caffeine. That's the power of unlocking epigenetic understanding, is so that we can personalize it down to your individual level. And I'm so excited about the future too. This is why I partnered with Brandon to bring like a lot of these educational workshops to the table, because the future is so personalized, and it makes holistic wellness so possible for us. We're walking away from one size fits all. And we could even get down probably to the level of like a specific protocol for someone, right? A specific IVF protocol, and like what the impact is going to be on the ovarian response, on whether what we have some egg donors, as a for instance, that don't produce a lot of eggs. Every single parameter looks amazing, but there's something that needs to be added to their specific protocol. And it happens about 30% of the time. It's not an insignificant amount of time. And that has to be epigenetic too, right? There's something on their follicular, response that you already, and maybe, or Brandon, maybe they were CBD users,
Yeah.
right? And we don't know. And like, we're stimulating even egg donors that might have epigenetic changes, right? To their follicular growth, so that they would be non-responsive in that first cycle, but then you add a drug and they are responsive in the second cycle. Yeah.
Right. And that's another area where this type of technology has a benefit that goes above and beyond this is if you could take this and have when women are donating eggs, or men are giving sperm samples in the egg bank or sperm bank.
That's right. Yep.
What if some of those egg banks and sperm banks would conduct an epigenetic, collect a sample from that donor, and then you would have a whole database of people where you could actually look and see which of those eggs, which of the sperm samples would have a higher epigenetic potential of actually implanting. So there's so much that you can do because there's even so like kind of bridging the gap on where Avrio was and where we are now. We developed this non-invasive PGTA test, and where we captured the DNA and the culture media from an embryo without having to biopsy. Or not develop. We offer this. Well, the other thing that you can do here of what I would like to see happen is being able to then epigenetically test embryos, because there is research out there showing that embryos are negatively affected by CBD exposure, and where it's not necessarily endometrial receptivity that's affected in the woman, but that the embryo actually has
from probably
itself
the egg
may not be able to attach properly because of that. So there's so much to look at. So there's a lot of ways that we want to try to dig into. The
future's exciting. Okay. The Carter wife. Yeah, exactly. Before we wrap up. So she does eat gluten, which I'm sure your doctor tells you not to do. Nightshades affect her more. So that's definitely an epigenetic impact. So like the nightshades, are turning on your inflammatory markers. And what to eat to counteract that, because pasta is easy, a sandwich is easy. It totally is. There's at least just buying gluten-free pastas and gluten-free bread, I would say would be one of the biggest things. And if you don't notice a difference, unfortunately, without epigenetic tests to tell us what to do specifically, we have to kind of experiment, right? Yeah. I know that as I got older, something in wine, all wines, probably the sulfites, make me super inflamed the next day. I'm retaining so much water. I can have a vodka and have zero impact. So I feel you, the Carter wife. It's a work in progress. Don't worry. We understand completely. And so it is a bit of an experimentation with our own body sometimes, because we don't have the precision tools like epigenetic testing readily available. And someone asked, are you going to be shipping kits outside of the US? I know your lab is in Houston, so as long as somebody can get a kit back to you in Houston, are there any restrictions on where you can ship a kit, do you think?
There's some restrictions on countries of where you can and can't ship human samples out of the country.
Even saliva. Okay.
Even saliva, but it's very few.
Okay.
There's restrictions on the shipping of embryos and like biopsies, and saliva has a bit less of restrictions, but there's a few countries where it makes it hard to. It's primarily, well, I know China's one, and then a couple of countries in Southeast Asia. India is another. Some of the United Arab Emirates. There's a few. But it's there's.
So Allie Uncle, let us know where you are. Since you're not in the States. Are you in Canada? Are you in Germany, UK? Just let us know, and we'll see if Brandon can get you a kit. Yes, Bella Linda, inflammation can cause infertility. Usually on Tuesdays, we've missed a couple of weeks due to scheduling issues. I interview our naturopathic MD, Dr. Raquel, and we talk a lot about inflammation leading to infertility. Given that you've had acid reflux for 14 years and have had trouble conceiving, and you've been trying for 4, I'd like to invite you to connect with us on our DM, because I want to introduce you to a company called Microgenesis. Microgenesis is in a pre-release study. Brandon's in pre-release. He's about to release this publicly. So he's giving away 10 kits. They're giving away 40 microbiome testing solutions. You'd be a perfect candidate for that with the acid reflux. They solve gut dysbiosis, which typically leads to solving unexplained infertility. So we love bringing these kinds of solutions to market and partnering with folks to bring the right type of research. We have a medical and scientific advisory board that vets all these partners that we work with, because it is important that they're doing research or that they hold the right research. And it's always great to have a third party like us looking on it. So we would never bring anything to our community that hasn't been pre-vetted by everyone. Yep, I'm wrapping up. This little one, who's a product of IVF and being a day 2 frozen embryo for 5 years, has a tooth that's hanging down to here and is about to just fall out, and he won't pull it out. And there must be an epigenetic research on emotionally, why he's resistant to just yanking it out. But it's very cute. It's just literally hanging out there. Oh, Allie Uncle's in Spain. We can get you kids to Spain.
Oh yeah, sure.
We're fine in Spain. We got a huge network in Spain, so we'll be able to work with you. So I want to wrap this up by letting everybody know. I wrote down Andrea and the Carter wife wants to be in on the first 10 kits that are available. Awesome. Allie Uncle, if you want to be in on that too, just DM us your email so that I can connect you directly to Brandon's team to ship you a kit when they're ready. And then, all we ask is that you just give feedback to Brandon's team. Let us know what worked about the report, what was confusing, how it was helpful, and stay in touch, because we want to follow your journey and see how these tools have been useful. Brandon, this is so exciting. There's other questions that people, probably do have. So I want to remind them that they can ask those questions on the Fertility Answers app, and either you or your chief scientific officer can hop on and answer them. And and then they can also connect with you at Fertility Genetics on Instagram, right?
Avrio Genetics.
Sorry, Avrio Genetics. Yes,
I was like,
not just Fertility Genetics. I'm
like,
wait, that's the wrong one.
I thought you created a new account. I did
not. Yeah, I did not.
That's the combination of both of us.
It is. I think I have that domain.
Genetics.
You can have it now.
Yes.
I do have that domain. I'll just give it to you. I do, actually. Yeah. Red Cruise, if you're doing microgenesis, I would say hold off on this, just because you're kind of in process of making positive epigenetic changes. So I would say don't do both at the same time. Just wait. But we're so grateful to this community. This will be saved on our IGTV if you know people who need to listen to it. And as always, thanks, Brandon. Our conversations are always incredible and exciting, and Alice. The future is so bright. So we'll see everybody next time.
Thanks, everybody. Thanks for all your questions.
You.
Thank you.